Bryan Health takes the responsibility to lead and to do the things that make everyone better, healthier, and moving forward together. Here's another of our Bryan Health Radio podcast interviews with Melanie Cole.
Plantar fasciitis is a common problem that causes pain under the heel bone, often with lengthy walks and prolonged standing. This and other conditions can be quite painful. However, there is a new, minimally invasive procedure that can really help. My guest today is Dr. Michael Budler. He's an interventional radiologist with Bryan Health. Welcome to the show. Dr. Budler, tell us first, what is plantar fasciitis?
Thanks, Melanie. Plantar fasciitis is probably the most common cause of heel pain. It's inflammation in the banded tissue that connects the heel bone to the toes. And approximately 3 million people suffer from this plantar fasciitis per year, not counting the silent sufferers that don't see their doctor.
So how would somebody know that they have this? What are some of the symptoms of it?
Okay, the pain is usually worse in the morning when you take that first step when you get out of bed. And a lot of times this plantar fasciitis is caused from long-term overuse, such as repetitive motion, maybe standing on your feet all day if you have a job like a teacher or a beautician, or even a single traumatic event, jumping off of a tailgate of a truck and landing too hard on your feet, causing inflammation.
Can shoes affect this? Do they help contribute to the cause?
Sometimes certain types of shoes can stress that plantar fascia and cause that as well. Yes, that's correct.
So then what's the first line of defense? When would somebody come to see a doctor about their plantar fasciitis?
So the first line of treatment is usually resting the foot or over-the-counter pain meds such as Tylenol or ibuprofen. People try inserts or orthotics or even just changing shoes. You can also try stretching or massaging the plantar fascia, icing, night splints, foot braces. But if you've tried conservative treatments like these for, let's say, 6 months, and you're still restricting your daily activities because of the pain, then you probably need to see your doctor.
So then tell us about this minimally invasive procedure that I mentioned in the introduction and how that can help people.
So the Tenex procedure involves an ultrasonic instrument that is utilized to break up the damaged tissue in the plantar fascia. It's performed through a tiny nick in the skin, and we can see what we're doing with ultrasound guidance real time. This instrument goes into the bad plantar fascia tissue and moves 29,000 times a second, breaks up this tissue without hurting normal plantar fascia, and removes it. And then we just put a little stray strip over that, and you wear a walking boot for a couple weeks.
So then you can get back to work. It's an outpatient procedure. You can get back to work pretty quickly?
Yes. So you will walk out that day. It's an outpatient procedure. It takes about 20 minutes. We usually use just local anesthetic. And by 6 to 8 weeks, you're feeling pretty good and can return to your normal activities.
What other conditions can this Tenex procedure help?
So the Tenex instrument can be utilized for golfer's elbow, which is pain on the inside of the elbow, tennis elbow, which is pain on the outside of the elbow, patellar tendonitis, which is jumper's knee or pain on the front of the kneecap, just the front inferior edge of the kneecap. It can help Achilles tendonitis as well.
So tell us a little bit about how it helps the patients and some results that you've seen, how it helps them get their lives back.
Since the procedure is a minimally invasive procedure performed through a tiny nick in the skin, healing time is usually much quicker. Patients can resume their normal activities quicker as well. And like an example would be, we had a high school senior that had actually both plantar fascia treated for plantar fasciitis. She was able to resume her senior year basketball season and she actually set a state scoring record and had a great season. And we have numerous other patients that have done very well and healed very quickly.
That's so cool. And she was able to get right back into it and then even break records. So now if somebody is an elderly patient and maybe they have arthritis and some of these things, can it help them too?
Absolutely. This procedure really is able to treat all age groups, and the only difference would be maybe a difference in time it takes to heal, but that time is still shortened with the Tenex compared to, say, an open surgical type procedure.
So then tell us about afterward. If they've had the Tenex procedure, is this something like plantar fasciitis that comes back? Does this need to be redone sometimes?
Only very rarely is it needed for a second treatment. And most of the time when patients have this, they're treated, the plantar fasciitis goes away. But if their plantar fasciitis all healed and they injure it again, they certainly could develop plantar fasciitis again and need treatment again, but we just haven't seen that.
And if somebody is a runner, for example, can they get back to running, and does that pounding make it come back?
That's a great question. We have treated multiple runners that have been able to return to the running, and it just depends on the amount of running that they do or overuse that they get as far as if they're going to injure that plantar fascia again and need it again. But we have not had to retreat any of our runners that we've treated.
So you mentioned golfer's elbow, Dr. Budler. Is that something that comes from that repetitive motion, or is that from a golfer hitting the ground when they're swinging the club?
Of the golfers we've treated, the most likely etiology for the golfer's elbow is the repetitive motion and the swing, the multiple swings over and over. It really hasn't been the traumatic injury of hitting the ground with the golf club causing that strain. Usually it's the repetitive motion that's caused the golfer's elbow.
And how soon after Tenex treatment can they get back to playing golf? Because golfers like to not miss getting out there on the greens.
Well, we usually tell them that we do not want them to swing a club before 8 weeks. And then, if they're a quick healer and the pain is gone by 8 weeks, where they can get back into the game. And like anything else, easing back into it, not going out and playing golf for 18 holes right away.
So then in the last few minutes here, give your best advice for people that might be suffering from golfer's elbow or tennis elbow or plantar fasciitis or jumper's knee, Achilles tendonitis, the best advice that you would give them and why they should come to Bryan Health for their care.
Well, my advice would be to really risk the injured part. I would be conservative, use the pain relievers and conservative therapies such as the stretching and the icing and maybe the braces. But if this really doesn't work and you've tried this for 3 to 6 months, feel free to come in and get a consultation with us. We are actually the only Tenex Center of Excellence in Nebraska. We were the first interventional radiologists in the country to perform the Tenex procedure, so we have a lot of experience in diagnosing and treating patients with these various ailments.
And for your consultation, you can call Bryan Scheduling Center at 402-481-5121. That's 402-481-5121. Thank you so much, Dr. Budler, for being with us today. You're listening to Bryan Health Radio, and for more information, you can go to bryanhealth.org. That's bryanhealth.org. This is Melanie Cole. Thanks so much for listening.